Hey, Gillen here from the brokerage. If you're a Medicare broker, then prescription drug costs are top of mind right now for your clients. So in today's video, I'm excited to share with you a unique prescription drug discount program called GlicRX.
All right. Well, we're going to go ahead and jump right into this. I'm David Ireland with the brokerage. I'm one of the regional sales directors here. If you're not familiar with the brokerage website, thebrokerageinc.com is where you can find a login to the agent portal. That's where there is going to be a link to be able to sign up for this program that we're going through today. So with that, I'm going to go ahead and kick it over to Chris or Emily. I'm going to stop sharing and let you take over.
Awesome. Thank you, David. Emily, if you could bring up our onboarding webinar presentation, that would be great. And first and foremost, this is Chris Jacobs from Glic Health, and really excited to be chatting with each and every one of you today. Today, we're going to be talking about our product, GlicRX, which is a free prescription discount card and tool that each and every one of you will now have the ability to access and to use in your day-to-day business, especially for those of you who are focused on the Medicare space, as this will be incredibly important for your business leading up and during AEP this year. So let's dive right in. We got about 15-20 minutes of content for you guys, and then we will leave it up for another 15-20 minutes of Q&A and then wrap up from there. So here's our quick agenda. What is GlicRX? How can GlicRX help drive your core product sales? So really the crux of this conversation will be talking about how do you weave in a prescription discount card to help aid your core product sales? Yes, earning commissions on prescription discount cards is fantastic, but using it as a tool to deliver tremendous amounts of value to each and every one of your customers will help you retain more customers and sell and enroll more new customers. And then finally, we'll wrap up with how do I get started, which is a very simple process. So let's dive right in. So GlicRX is a free prescription discount card that can help customers save up to $95 or more on prescription medications, both brand and generic. Every patient is eligible, even if they have insurance or Medicare. We'll go over some of those use cases today. GlicRX works at every major retail pharmacy nationwide. In fact, we have about 35,000, just over 35,000 pharmacies across the country that accept our product. Okay, so we're talking about CVS, Walgreens, Walmart, Rite Aid, Target, Kroger, Albertsons, Wegmans, Duane Reade, H-E-B, Smiths. I can go on and on and on. Costco, of all the different brands that we work with. When you get signed up, you'll have access to something called our pricing tool, and you'll be able to see a full list of pharmacies that are available, right? And one thing I really want to make sure that we hammer home today, and this is sort of a fundamental core value of Glic Health and our GlicRX product, is protection of your client's information. And so one of the ways we do that is by not collecting, maintaining, or storing any personal health information whatsoever. We don't even get it. It doesn't hit our system, okay? So this is something that really sets us apart from a lot of companies in the healthcare space these days, especially our main competitor, GoodRx, is simply put, we don't collect, maintain, or sell any personal health information whatsoever, all right? Moving to the next slide here, Emily. So how does GlicRX work? First question. So we work with a network of pharmacies across the country and negotiate pricing with those pharmacies that can be accessed through our prescription discount card, okay? So basically, we have a ton of customers that have our discount card, and there's a lot of pharmacies out there that want access to these customers. And so we effectively broker a better relationship between the pharmacies and our customers, okay? Now, the pharmacy, where the pharmacies get out of it, pretty simple. We help drive traffic to their pharmacies. In exchange, we receive what's called an admin fee for each prescription that somebody purchases using the card. That admin fee is paid to us by the pharmacy, to be very clear. So if somebody goes to CVS, for example, and they fill a prescription for, let's say, generic Lipitor and saves money on their medication, CVS will pay us an admin fee for that transaction, okay? So effectively, the card goes out to the customer brings the card to the pharmacy, and there's no eligibility, there's no age or income restrictions. Anyone can use this card, okay? They get the card, they bring it to the pharmacy, save on their medication, and then that generates an admin fee paid to us by that particular pharmacy. Next slide, Emily. So how does it work in terms of, in terms of the customer experience, okay? And then I'll go over a couple of quick sort of use cases as well. So it's very, very simple. If you remember anything from this presentation, just remember this. All the customer has to do is bring the card to the pharmacy, okay? Whether they bring it via email, meaning they show the email on their phone, whether they download the GlicRX mobile application, whether they print off an email and show it at the pharmacy, or they get a physical card from you, okay? And we'll have training webinars, I believe, later this month and into August, talking about the various ways in which you can get the card and market the card. But just remember this rule of thumb. The customer just simply has to bring the card and present it at the pharmacy counter. At that time, the pharmacist will run a price check using the card information. So they're going to check to see whether it's cheaper than their copay, or maybe the drug is not covered. There are thousands of medications, for example, that are not covered by Medicare that people are purchasing every single day. And then if the price is lower than the insurance / their Medicare plan, or their copay, or maybe their plan doesn't cover the medication, the patient will always pay the lower price. Okay, so rule of thumb, get the card into the hands of the customer, have them bring it to the pharmacy, and the pharmacist or the pharmacy technician will do the work for them. Okay, one note I do want to make sure that everybody understands, and this is true of all prescription discount cards, is that the GlicRX card cannot be used in conjunction with a copay. Okay, so there's no situation where you can get a discount on your copay using our card. Okay. Additionally, it does not count towards any deductibles. Okay, so this is something that, as an agent and as a and your customers need to be, they need to understand this, and they need to be aware of this going forward. Okay. Next slide, Emily. So, the use cases for using the prescription discount card. All right. So when should somebody, or when should a customer use a discount card? Number one, very simple. When Medicare doesn't cover a drug, or your insurance does not cover a drug, maybe you sell ACA as well. Okay. So when that drug's not covered, fantastic opportunity to save money on your prescriptions. Two really good categories for this is vitamin supplements and weight loss. So prescription vitamin D, and I want to be very clear, not over-the-counter vitamin D, but prescription vitamin D, for instance, is not, generally speaking, is not covered by Medicare. Some other examples: when you have insurance but your copay is high. So let's say your customer has a $40 copay. Generally speaking, $40 copay, we beat that price 62% of the time. So it's a fantastic time for the customer to compare the copay versus the cash discount price. Another example is if you haven't hit your deductible yet and the prescription cost during that month is just too high. With gas prices the way that they are and inflation going through the roof, we are finding that this is more and more the case for everyday Americans. Okay. Another thing too is maybe that customer, based on the prescriptions that they take on a regular basis or not regular basis, is just not going to hit their deductible that year. So there's no reason for them not to use the prescription discount card, right? And then the fourth and final example, very simple, is if you simply do not have health insurance. One quick question. Frank Frey asked, will the pharmacy compare it to GoodRx if that customer usually uses GoodRx? Yes, absolutely. And Frank, in fact, we have a top 50 file of the most popular medications that are prescribed across the country. A good chunk of them are not covered by Medicare, and our pricing versus GoodRx. And we're going to talk about GoodRx in a little bit later on in this presentation. So, as we know, no matter how good the plan is that you enroll your customers in, generally speaking, those plans, as we know, are just simply not good enough, right? Even if you do your absolute best to get them on the right plan for that customer, there's always gaps in coverage, and there's always issues with costs. And so this generally creates two problems for the customer, or sorry, two problems, one for you, the agent, and one for the customer. Moving to the next slide, Emily. So the problem for the customer is simply, affording their medications, and we help solve this problem. Okay, drugs that are out of coverage, and really focusing on helping customers afford their prescriptions. Okay, and the problem for the agents, as we know, the most difficult part of your conversation with a customer is talking about their prescription costs, which obviously our product here helps them resolve. And the second thing is what doctors are in and out of coverage. Unfortunately, we don't have a solution for that, so you guys are still on your own on that one. But we can absolutely help you guys with this other problem during your sales process. Okay. Next slide, Emily. So how does it help drive core product sales? So we work with a ton of agents across the country, and the overwhelming feedback that we get from them, because we talk to them on a daily basis via email, via chat, on the phone, we're constantly doing trainings and doing live Q&As, is there's two things. Number one, it helps increase new client sales. So if you think about all these different people that you've been trying to sell over the last few years and these new leads that you now have in your system, okay, if you're able to get them a prescription discount card now and help them save hundreds, if not thousands of dollars outside of AEP, the chances are that you will be able to sell that client and enroll that client during next year's AEP. All right. So it really helps drive new sales for you. Okay. The second thing is, actually, Emily, go back one slide real quick. Thank you. The second thing is you have a book of existing clients. And one really important thing that each and every good agent should be doing throughout the year is finding ways to drive value for each and every one of those clients outside of enrolling them in the proper plan. So once you've enrolled them in the proper plan, if you can help them, again, save hundreds, if not thousands of dollars on their prescriptions, the chances are next year during AEP, you're going to retain that client. Okay. And we've seen retention percentage increases across the board with agents who use our product effectively. Right. And we have stories of people saving $200, $500, $700, sometimes even $1,800 on a single prescription that before they were paying full cash price. And so it's that type of impact that you can have on your clients. In fact, I believe with our Medicare agents specifically, the average savings per prescription is between $80 and $100. That's a lot of money for just one prescription, right? Next slide, Emily. So one thing I really want to make sure that each and every one of you understand is that GlicRX, who I believe most of you, generally speaking, have referred, is now moving into the Medicare space. Okay, so they have partnered with GoHealth, and GoHealth is a direct competitor of yours. Okay, so GoHealth is a major seller of Medicare products. They're all call center based. Okay, and they do the fulfillment for GlicRX. So to be very specific and to be really clear here, if you are referring your clients to GlicRX, you are directly handing leads to a competitor. Okay, moving to the next slide here. So, using a prescription discount card in your pitch is a really good idea. And a lot of you have been able to use GlicRX effectively as sort of a value-added benefit and service. And you have this knowledge base about prescription discount cards, which again, can help your client. But again, referring GlicRX is a mistake. Okay, because number one, you might not be saving your customer the most amount of money. So I'll give you a quick example. At Walgreens specifically, on the top 100 drugs that are prescribed, we beat GlicRX in over 90% of those medications. At CVS, it's about 75% of those medications. Okay, not to mention, again, you are handing clients directly to a competitor. Next slide, Emily. So why should you stop referring GlicRX? Again, specifically, GlicRX is actively referring your clients to GoHealth. They have entered into the Medicare space. GlicRX pays you, so you actually can earn commissions on each and every one of the prescriptions that are filled using the card. Okay. And then the third point, again, I talked about this on the onset of the presentation. We do not store, use, or sell any personal health information whatsoever. All right. So again, as I said before, 90+% of the time we're beating GoodRx at Walgreens, and at CVS, that number this month is actually over 70%. Right. So at minimum, it's 66%. This month, it's actually well over 70%, which we're really happy about. Okay. Next slide here, Emily. So 3 easy steps. And David, I want to bring you back into this part of the conversation here. So the first thing is how can agents get signed up to distribute the GlicRX card? Because I know we're working on this process right now, but I just want everyone to know sort of what's coming down the pipe.
Sure. So again, in the broker link, so that's your agent portal that you log into to access the behind the curtains information with the Brokerage Inc. for brokerage agents. There will be a quick form for you to be able to go in there, review all the documentation, and sign up for it. There will also be in there the additional information about the actual payment amounts.
Okay, perfect. So once you guys sign up through the brokerage system, you're going to get a welcome email from GlicRX. This will have all of your credentials. Okay. So this will have your access to the enrollment center. We will talk about that on a future training webinar. Okay. In fact, Emily, if you could pull up, do we have dates lined up for future webinars? If we do, if you wouldn't mind posting that in the chat, I think that'd be a good time to promote those dates.
I'm not sure if we have any set at this time. Let me look and see though.
No problem. Okay, so we will be sending you guys out dates probably later this week for the training webinar. So effectively that is, okay, I've signed up to use GlicRX. I have my welcome email. What do I do now? How do I weave this into my pitch? How do I use the GlicRX system? I promise you, it'll be the easiest training webinar you've ever done. It's about 15-20 minutes of content, followed by another 15-20 minutes of Q&A. It's very simple and straightforward. Okay, so number one, you guys sign up through your agent link or through the brokerage portal. Number two, you're gonna get a welcome email from GlicRX. Okay, that will allow you to start marketing the card right away. So if you want to click in and start figuring out how to use the system, you absolutely can do that. Okay, and then number three, definitely join one of our training webinars. They're really, really effective. They're really short and simple, and it's a lot of great information in a short amount of time. Okay, if we could go to the next slide here. So I will cover compliance in 1 minute or less. So please do not plug your ears or turn away. We have 3 very, very simple rules. Number one, do not pay any pharmacists or doctors to distribute the card. Number two, you are not allowed to charge anyone for the GlicRX card. So if you're giving it to a customer, you cannot charge them $1, 20 cents, $5, $20. You cannot charge them for the card. Okay. Then number three, you cannot create your own marketing materials without them being approved by Glic Health. In the training webinar, we go over the process for getting marketing materials approved. A lot of you have really popular LinkedIn profiles or Facebook pages or websites. We want you to continue to use them, and we want you to put GlicRX on those websites and offer this product to customers or to family, friends, the bartender down the street, to new potential customers, right? To new leads that you're working on. You can give this card to anyone. It's a product you can market 24/7, 365. All right. I want to go over a couple of quick questions here. So a couple of things. So Linda said, I mostly sell Medicare Advantage plans. The contract states as a client that they get all their prescriptions from the plan. So that's all the prescriptions covered by the plan. So if it's covered by the plan, generally speaking, that's going to be the cheaper option. Not always, but that's going to be the cheaper option. If it's not covered by the plan, and there are about 4,000 medications that are relevant that are not covered, they absolutely can continue to use the card. Melissa asked how this compared to GlicRX. So GlicRX is actually a third-party provider At one point, they were actually a client of Glic Health. They were marketing our product. They're not very competitive from a pricing standpoint. Also, in terms of agent tools, portal, data, reporting, their product is more like a Toyota Camry if our product's like a Ferrari, to give you an example. If you are signed up with GlicRX, I think you'll see that right away. Additionally, Melissa, we actually have a dedicated agent support team. So any time during the week, you can actually call. And Emily, if you could post into the chat our agent support number as well as the email address. You can ask questions about GlicRX if you're having technical difficulties with your dashboard, or maybe your email didn't come through, or if you have questions about marketing or getting the card out, what's okay, what's not okay. We have a support team that's here for you 24/7. Okay. Will the agents have a PURL? Jordan, I apologize. What is a PURL? I'm assuming it's a personal link.
It is. That would be a
personal
personalized
URL. There we go. Gotcha. Yes. So Jordan, when you sign up, and actually we go over this specifically in the training webinar, when you sign up, you will get a personal URL, which you can send to clients. When they sign up for the card, either the website or maybe they download the mobile application, you will receive credit for all of those transactions going forward. So yes, 100% you will be getting your own personal URL. Just confirming the card has no cost. Irene, absolutely no cost to work with us. If you choose to print cards, yes, there could be a cost there. However, we have an enrollment center. Again, we'll go over this in the training webinar, where you can get clients the card at absolutely no cost to them. Will these be available through other channels? I'm assuming, Stephen, if you wouldn't mind clarifying your question in terms of what you mean by other channels, happy to answer that. The link with more info. Let me just scan through here. Have you vetted this with state insurance regulators? Yes, we have. It is not in violation of insurance laws, Andrew. In fact, prescription discount cards are not, they're not governed under insurance laws either. So there's something called the DMPO licensure, which is how this is governed. And yes, this absolutely can be used instead of insurance. It can be used instead of your copay, and especially for prescriptions that are not covered by insurance, right? That's normally the biggest opportunity to use the card. Angie, do you have something already approved for Facebook marketing we can use? Angie, if you join the first training webinar on August 9th, you will find out. But when you get your welcome email, you can click around, and yes, we absolutely have materials for you to use, excuse me. Just because you have a prescription card doesn't mean you have to use it. Cindy, that's a great point. No, you don't have to use it. If your insurance is cheaper, absolutely use your insurance. That's the best option for the client, and that's what we're trying to achieve here. Does this card pay for new migraine medications? So Polly, we do cover brand medications. There are a lot of different migraine medications out there, and our pricing tool will help you figure out how much the customer will save. All right. Marianne asks, so we give them away for free, and when they use them, we get paid. Yes, that's absolutely correct. Is there a referral program if we get other agents to sign up? Sandra, yes, absolutely. So make sure you work with David and the brokerage team on, making sure you get those overrides. Let me just go through the last few questions here. Yeah, so Nicole, how GoodRx gives our clients info to Go Health. So if your client signs up on Go Health, they have your information. It's sort of like when you sign up to use an iPhone and you click terms and conditions. It basically gives them the right to use the client's data in almost any way, shape, or form. Okay. And then you will see at the beginning of AEP, you will get emails from Go Health and even beforehand that are very much focused on getting people to call in to enroll in a Medicare plan. Okay. Emily posted the GlicRX agent support number, call us anytime, as well as the agent support email. We have a bunch of people dedicated to that email that are constantly replying to any questions you guys have. Sharon asks, is this for Medicare people only? Absolutely not. This is for over 65, under 65, female, male, does not matter age or income, no eligibility required. Anybody can use this product. Okay. Can I print my own agency's logo on the card? Andrew, unfortunately, if there is something that's highly regulated, it's actually the card itself and making sure that the card and the materials are compliant, and we take that very seriously. However, you can wrap the card into other materials that has your agency's logo on that. So Andrew, I would suggest that once you get signed up, you contact our agent support team and we will help you through that process. Okay. Hold on one second. Let me just get through these last questions here. So Greg asks, Greg asked the following question: how can a member be assured that the pharmacy is correctly presenting copays or GlicRX is less? It's a great question, Greg. It's actually illegal for the pharmacist to tell you something different. So when the customer goes in, they have to get the cash price, meaning the pharmacist or the pharm tech has to tell you what the cash price is. It's illegal for them not to. Okay. This law, I believe, went into effect in January of 2022. They have to tell you what the cash price is. Okay. So make sure that your customers know when they go in, present this card and make sure that they know what the cash price is before they go ahead and pay that copay. Salim Ali asked, can anyone market this or does it have to be an insurance agent? Fantastic question. Anybody can market this product. So you do not have to be a licensed insurance agent to market this product. It works very, very differently than health insurance or any other insurance for that matter. So anybody can sign up to market the GlicRX card. Okay. Does the client sign up so you know who's using it? So we don't know who's using it. This was asked by Matt Curry. We don't know who's using the card. If the client signs up via GlicRX and gives us, for example, their email, the only way in which that email is used is to simply deliver them the card via email. Okay, so this is really important to understand. When they sign up via GlicRX.com, or for example, if they download the mobile application and they put in their email, which is technically speaking not required, you can hand them a physical card. We do not know who's using the card. Okay, we only just see transactions coming through, but they are not attached to any one individual. So again, we do not collect any PHI whatsoever. And if we do get an email, it's simply to deliver them the card. All right. David, any questions from your team? I know this is our first, well, here we go. Marianne just asked, how do we get paid? So there you go.
Yeah, so basically the money from every time they fill a prescription is going to funnel through the brokerage, and then on our next pay cycle, we will pay you the agent for that. Again, there's going to be more details on exactly those amounts and exactly the timeframes posted in the link in the broker link. That's going to be where you'll also be able to find a recording of this presentation. We will compile a list of frequently asked questions as well. So we'll kind of filter through these questions and put together a little fact document for you as well. Chris, I did see a couple of questions here that I think are pretty good about.
Absolutely.
You mentioned you can't pay providers or pharmacists, but if an agent has a relationship with a doctor's office, can they leave stacks of the cards in there?
Phenomenal question. And yes, absolutely they can. So Greg, thank you so much for asking this question, and Maria as well. So two fantastic opportunities to market the card. And we have some agents that generate 20 to 30,000 transactions a month because of their relationship with pharmacists. So what you absolutely can do now, you cannot pay them. You can't give them donuts, stickers, gift cards. You can't give them pizza, money, anything, but you can give cards to your local doctor and you can give cards to your pharmacist for them to use for their patients. Okay. And a lot of you, I'm sure, get referrals from pharmacists or maybe set up a stand or a booth at a Walgreens during AEP, right?
But then
So you can absolutely market the card to pharmacists and have them use it for their customers. Okay. Marianne, we did just go over how you get paid, so I think we answered that question. Linda asked a great question. Will the patient need a paper prescription? Most doctors are using automated systems to send it to the pharmacy. Linda, they do not need a paper prescription. All they have to do is bring in their discount card to the pharmacy. Okay. Salim asked, as an agent, do we get any info if somebody signs up? Again, this is sort of a way where we're, again, protecting information. When somebody signs up, it simply is to deliver the card to that customer, and then that information is never used again. It's never connected to any PHI. It is simply a delivery mechanism to get them the card. So no, there's no info on when people sign up. Okay. Matt asked a phenomenal question, and I'm really happy he did. Will the customer price be the same at Walmart versus CVS versus Walgreens? No. So right now I'm actually in Jackson Hole, Wyoming, about to go on a camping trip. And if you look at the Albertsons here versus, I think there's a CVS down the street, the prices will actually be different. And so we have a pricing tool, which Emily in our training webinar will go over with you guys, that will show you based on your local area, which pharmacies have the best price. Okay. Irene asked, so if no PHI is collected, how do you track who gets paid? Will the actual card have a way to get way to list our agent number? So when you sign up, Emily's going to go over this in the training webinar. You'll be assigned a group number. I'm not going to go into the details on this call, so I don't confuse anybody here on how that works, but we track your group number, but that does not track PHI. Okay. So we track how many transactions you generate, but again, we do not track any PHI. Okay. Can the brokerage tell us who is using the cards we gave them? No, Marianne, we don't collect PHI, so the brokerage won't know who's using the card, and neither will we. Okay. Angelita asks, how many cards will we be getting? Well, you can purchase cards and hand them out physically, or you can hand them out digitally. We got a lot more questions here, and we're running out of time. So let me just make sure. Yeah, so Andrew asked, do you have data on the number of times on average a card user actually uses the card? Andrew, ping our agent support team and we can address that privately. So that's pretty confidential information that is pretty core to our business, but we can definitely talk to you about that. Maybe we can set up a call to talk about that specifically. Justin Holland asked, would this complement our group benefits clients? Yes, absolutely. So we have tons of agents that are in the TPA space or work with groups or unions that give out the card as an additional benefit to the product that they already provide, and it absolutely can help them save. So great question, Justin. Let's see here. Sharon, you are paid per transaction, not when the card is issued. So when people save using the card, you're paid for that transaction. Okay. Marianne, yes. So you will have a group number on your card that'll be assigned to you when you sign up. And then that's how we know you're generating transactions, and then how you are then paid. How long will it take for us to receive the cards after ordering them? I believe it's 3 to 5 business days. Stephen, purchased a card, ? Yes, we have a system where you can order via Vistaprint. So you can order physical cards. They do cost money, but there are plenty of digital solutions for you to use as well. Sylvia, will our personal phone and name be on the cards of the customers for the customers to contact us if they have questions? No, we can't make any edits to the card for compliance reasons. We take compliance incredibly seriously, but you can provide them other marketing materials with your information on it. Okay.
Just want to clarify a couple things, and Chris, correct me if I'm wrong, but there seems to be some confusion over buying the card. So this is a digital world we live in. Usually you can show, like even with digital coupons, when you go to a grocery store, there's something like a barcode, so to speak. So there's a digital card. Those are absolutely free. Nobody's paying for any of those. If you want to print out like a stack of physical cards that you can hand out, there is a cost to you to do that because you're having to pay Vistaprint to do that. So if you want to have the physical cards to hand out, you can do that. Otherwise, I have a feeling we're going to learn a lot more in the next training about how easy it is to just get them a digital version of it. And I also imagine, Chris, there might even be a simple way for them to print out an email with the
I was
code
just
on
going
it.
to say, yep, 100%. There is a million different ways to do this at absolutely no cost. Now, we definitely have a lot of agents that print cards, and they pay for those cards to be printed, and they're very effective in getting those out. But we have a lot of different tools for you guys to use that is absolutely free.
All right.
All right. Awesome.
All right. Well, thank you so much for your time. This is really exciting, especially when the news broke of the GlicRX and Go Health partnership. I know quite a few people became a little concerned about that, about handing away their clients to others. So this is a great alternative solution.
I just posted in the chat the agent support number and agent support email. It's 844-630-8300 or agent support at Glic, Glic health.com. A lot of people are sort of chomping at the bit saying, can we start distributing before the next training webinar, so on and so forth? Yes, if you're signed up, please reach out to us. We will help you in advance. And then, I would still strongly encourage you to come to the next training webinar. But for those of you who have maybe clients who have immediate needs, make sure you get signed up and we can help you immediately. And I just want to thank the brokerage team for inviting us today. We're really excited to work with you guys and each and every one of your agents. And we're here to help. So David, thank you so much for putting this presentation together. And we look forward to working with you guys.
Us as well. Thank you so much. All right, everybody. Have a great rest of your day.
All right, guys. Well, thank you so much for watching this video. If you'd like more content like this, remember, you can always go to thebrokerageinc.com, head over to our webinars page to find more.